Let me guess, you've told yourself, I don't have time for therapy. Between 12-hour shifts, charting, trying to have a life outside of work, it could feel impossible to squeeze in one more thing. I get it. But burnout doesn't wait. Anxiety doesn't wait. And your mental health, that definitely shouldn't wait. That's where Rula comes in. R-U-L-A. Rula connects you with licensed therapists who are in network with your insurance, often for as little as $15 a session. And get this, you could be matched with someone and start therapy as soon as tomorrow. No wait list, no calling around, no mental gymnastics trying to figure out if they take your plan. Rula makes it easy, affordable, and actually doable, even with the nurse's busy schedule. Thousands of people are already using Rula to get affordable, high-quality therapy that's actually covered by insurance. Visit rula.com/nursemo to get started. After you sign up, you'll be asked how you heard about them. Please support the show and let them know I sent you. That's rula.com/nursemo. You deserve mental health care that works with you, not against your budget. Well, hello there. I'm Nurse Mo, and this is Mo's Monday Minute, a shorty episode of the Straight A Nursing Podcast, where I share a quick tip you can start using to improve your practice or habits right away. For more in-depth episodes, check out the ones that I release on Thursdays. So today we're taking a quick dive into things that can exacerbate orthostatic hypotension. So orthostatic hypotension can be pronounced in circumstances where vasodilation is present and or cardiac output is already reduced. And if you want to dive way deeper into orthostatic hypotension, then check out one of my Thursday episodes, episode 297. I take a much deeper dive in that episode, but just some quick things to be aware of are hot weather. Blood vessels dilate in hot weather, and they do this as a way to bring blood towards the surface of the skin so that it can dispel heat and keep the body cooler. But what happens when blood vessels dilate? Blood pressure can go down. This can exacerbate your orthostatic hypotension. Another is fluid volume deficit, or your patient who is dehydrated. Now, this could be from decreased fluid intake. This could be from diuresis. Maybe they're taking furosemide or something like that. Even fluid losses through diarrhea would leave the patient with a fluid volume deficit. Same with vomiting, same with a large wound that is weeping fluid and you're losing a lot of fluid, like in a very large burn. So any situation where you have a fluid volume deficit is going to exacerbate orthostatic hypotension. Another is alcohol intake. Not only does alcohol have a diuretic effect, it also causes vasodilation, which guess what, is going to exacerbate our orthostatic hypotension. Another is prolonged standing. Standing for long periods of time can cause blood to pool in the lower extremities. Over time, this can put pressure on the veins, causing weak valves and venous distension. And this leads to the development of varicose veins and predisposes that individual to increased venous pooling. And guess what? Can exacerbate orthostatic hypotension. And another is prolonged bed rest. Though bed rest is common in the clinical setting, even though we try for it not to be, so people just simply are not getting up and moving around like they do at home. Studies show that it contributes significantly to cardiovascular deconditioning and impaired hormonal response to changes in blood pressure. So be very aware of this when getting your patient out of bed if they've been on bed rest for any length of time. So again, those key things are hot weather, fluid volume deficit, alcohol intake, prolonged standing, and prolonged bed rest. Again, if you want to dive way deeper into orthostatic hypotension, check out episode 297. See you there. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
Craving something refreshingly delicious? Meet Joyba ready-to-drink bubble tea, packed with juicy popping boba and bursting with bold, refreshing flavor. These delicious fruity bubble teas are available ready to drink at your local retailers. Just grab, go, and sip your way into bubble bliss. Discover Joyba's full flavor lineup and where to buy at joyba.com/shop.